Hi, Dr. Sal here, about to show you how to do a rowing exercise that helps build the back. This time it's going to engage the lower back as well as the Latissimus dorsi, which is that big muscle in the back that causes that V shape, or that what we call that lat spread or spreading the wings. There's a number of bars that you could use. The closer the grip, like in this particular case with this handle, will actually activate more of the medial or the middle part of that Latissimus dorsi. Now, when I say the middle part, I'm talking about that part that actually gets closer and closer to the spine. This being lateral, further out, medial, or towards the middle. So let's get going with the rowing on a cable rowing machine. And we want the feet to be stable and the knees slightly bent. You don't want to keep them straight like this because you'll activate the hamstrings. And we want to bend them, and we want to extend all the way so we're stretching. And at this point, I even feel my lower back muscles getting stretched. And what we want to do is we want to pull back as we're sitting up, arch the back so that it activates the middle portion of the Latissimus dorsi, and coming back up and down, breathing in. So when you watch me breathing, I use a completely different approach to breathing. We're usually taught to breathe out when we're bringing in the bar. In my particular case, I believe in breathing in when you're actually contracting that muscle. That's the point where your lungs start to expand, but you're also getting oxygen to the tissue. When you're blowing out that air, you're releasing not only carbon dioxide, but you're also getting rid of the oxygen that your muscles use. My breathing patterns are slightly different than what we've been taught all along. But then again, a lot of people don't realize that we pick up on these old traditions and think that that's the dogma, and then later realize that, oh no, it was supposed to be the opposite way. So these are some of the techniques that I try to encourage and teach my clients as well as my patients. And the objective here is to start developing more of a back that you could do some stretching, build that Latissimus dorsi. You're gonna get some muscles in the arms activated as well as the upper shoulders, like the posterior head of the deltoid. For more information, go to healthquestdrsal.com, where you could see all the literature and my podcasts, my recordings, and all my blogs to get information as to how you could restore your health. Until then, I'm Dr. Sal. Have a great day.